Hi everyone, my name is Brittany and I'm sharing my open heart surgery experience in a 5-part series. This second video will go over what I experienced during my recovery in the hospital. Now, your experience isn't going to be exactly the same, but I'm hoping to touch on themes so that you can best prepare for your surgery. Let's get started. My surgery was 4 hours long, and I was really hoping for a mitral valve repair versus a replacement. And thankfully, even though surgery wasn't the smoothest, they were able to do a repair. So the surgery was 4 hours, and then they keep you under for another 4 hours, maybe to maintain vitals or watch how you're doing. I'm not sure. But that meant that I woke up in the early evening that day. And when I woke up, the first thing that I remember is that I had a breathing tube in. So I kind of started gagging and trying to pull it out. And when the nurse realized what I was doing, she immediately came over to help me to get that out. And that was pretty easy. The second sensation that I remember after that breathing tube came out and after I kind of got out of the haziness of the medication was extreme thirst. So I asked the nurse for some water and she allowed me to have one sip, and unfortunately I threw it up. So if you want to experience pain, throw up right after you got out of open heart surgery. It was terrible. And at that point, I realized, or I learned, that when you're under anesthesia, your digestive system stops. So because I was under it for so long, 8 hours, my entire digestive system had stopped working, and you have to turn it back on manually. And that took a lot of hard work and a lot of throwing up of water before I was even able to get anything down. The next thing that you're going to experience in the ICU is waking up to the fact that you have 3 tubes and 2 wires coming out of your stomach right under your rib cage. Now, these 2 wires go to your heart, and they're a temporary pacemaker. The 3 tubes are drainage tubes that start at your heart, come out of your stomach, and lead to a box on the ground that is able to measure how much drainage fluids are coming out of you. Because the nurses want you to drain as many fluids as possible, they have you sitting upright in a chair for as soon as you're able and for as long as you're able. I can't stress this enough. These tubes were not the most comfortable things to have. So the 3 tubes were not small, they were decent size, and they would rub up against each other and rub against the back of my sternum, which was so uncomfortable. And on top of that, because I just had a major surgery to my chest, everything was swollen. And it's not like your arm is swollen where it can just get bigger. There's not a lot of room in your chest capacity for things to go, so everything is just so sensitive. Be prepared to have these tubes in you when you wake up from surgery. Thankfully, I had drained enough fluids to get them taken out 48 hours after I had gotten out of surgery. And in that process, you lay on a table, the nurses tell you to take a deep breath in, you exhale, and they just pull them all out. And now that feels worse than having the tubes in, but it feels so good to get those tubes out that, again, do anything you can to get those tubes out as soon as possible, and you will be much more comfortable. I can't stress this enough that be prepared for this. The nurses went over these in the pre-op courses, but I just didn't understand what this entailed until I went through it. So I want you to be prepared for these when you go through your surgery. Another pretty big thing that happens in the ICU is that you'll get all of your catheters taken out. So your wrist catheter, your bladder catheter, your neck catheter, all those will be taken out, and making sure that you're doing well. And then on top of that, you still have a lot of wires connected to you. So your heart rate monitor, which results in a lot of stickies all over your chest. And I can't even tell you all of the other wires that were connected to me. Basically, you're swimming in wires. And when I moved to the chair that was next to my bed, which was 1 step away, it took 3 nurses to get me from my bed to my chair just because of everything that was connected to me. And to give you an idea of your pain level in the ICU, or the pain level that I experienced, so as long as nothing was touching me and I wasn't moving, this included breathing, I was fine. But if someone touched my shoulder, which meant my sternum moved because my clavicle is connected to my shoulder and my sternum, or someone patted me on the thigh, which moved my torso, it is uncomfortable. So as long as your torso stays straight and stiff and nothing touches it, you will be fine. But anything beyond that, just be prepared to manage your pain level with that. I stayed in the ICU for about 24 hours, and then I was released to the General Heart Hospital. When I got to the General Heart Hospital, I was really hoping that things would quiet down, but be prepared, they don't. I was going to x-rays at 3 a.m. There was always medications to be taking or refilling, vitals to be analyzed, my weight to be taken, the trash to be taken out. I was really wanting to take a nap, and so I asked a nurse to put a sign on my door saying, "Don't disturb until this time, patient is sleeping." If you're experiencing the same thing, don't be scared to ask your nurse to do that, because that little nap really helped me get through the day, and I was really appreciative that they did that for me. Also, pro tip, make sure to bring pajama pants, a pair of underwear, and a robe. For me, I like to be modest and cover up, and there were just a bunch of slits in my robe, which I didn't like, or in my gown, so I was able to put my robe over it, and then when a nurse needed to attend to me, she could just easily open it and do what she needed to do. Also, my robe had a pocket in it, which was amazing because remember how I said you're gonna have a heart rate monitor attached to you? So that heart rate monitor is connected to a walkie-talkie type receptor. And I was able to put that in my pocket, which was great because when I had to take my walks, then I wasn't connected to anything that needed to be held onto one of those IV poles. So I could just go and take my walk, put it in my pocket, and take it out when I got back. Also, I'm a really cold person, so having pajama pants was really nice in those cold hospital rooms. Also, I wanted to let you all know that when I got out of the surgery, I walked with a really big hump. And when I saw the other patients in my nutrition class or walking around the hospital halls, they didn't. It looked like they were walking so easily and effortlessly straight up. And I was really frustrated by that. I brought it up to my surgeon and he said, no, when young people go through surgeries like this, they have so much muscle that when their chest is open on the operating table for 4 hours, it needs to be tightened and pulled together in order to get your chest closed again. And because of that muscle mass and that pulling and that tightening, it results in you being hunched over. So if you're frustrated maybe by walking with a huge hump or with anything else, I encourage you to keep going. Acknowledge that you're struggling with that and bring it up to the nurses, but work hard and push through it because it's only temporary. I did it and so can you. There's another thing I want to bring up for all of you out there. When I was in the ICU and in the hospital, I was really struggling with my pain management, and I was getting really frustrated because I was comparing myself to the other patients that looked like weren't having the same struggles that I was having. And I brought it up to my surgeon and he said, no, it's normal for a person of your age to struggle with pain management for 3 reasons. 1, you're younger, so you just don't have the pain experience that an older person has. Number 2, you're thinner, and a thin person's nerves are closer together, therefore they have a lower pain tolerance. And number 3, you have a lot of muscle in your chest, and when you have a lot of muscle in your chest, that's more that you have to get through, a more tissue that needs to be healing, and so that results in a lot more pain. When I talked to my surgeon about this, I felt better, and I was able to work with my nurse to help manage that pain level. I bring this up to you because there are going to be a lot of points in your journey where you're really frustrated with things that you don't perceive are going the way they planned or as well as you think they should. And I want to tell you that acknowledge that you're feeling that way, but also share it with your surgeon and with your nurse because they are there to help you get through this. Everyone's journey is different because everyone's bodies are different. So when you compare yourself to other people, that's inappropriate because they're dealing with something completely different than you are. I also want to say this recovery process will take a lot of hard work. It won't be easy. So continue to work hard and to fight through those hard moments, and you will get out of it on the other side. A lot of people have done this before, and you can do it too. I ended up spending a total of 4 days in the General Heart Hospital, and then I was released to go home. So I spent a total of 5 days in the hospital altogether. Now, before we move on to part 3, which I will explain my recovery process at home, if you have any questions, please leave it in the comment sections below, because I'm hoping to do a Q&A to answer everything I missed and questions that you may have. Now on to part 3.